Hello, my name is Nehal Desai, and I'm going to be talking about smoking cessation as part of the NAPLEX review course. As you can see, um, these are some of the topics that's covered in the respiratory section of this course. Um, One of the ones I'd like to talk about in this section is the smoking cessation, which is the topic that I'm going to be focusing on in this lecture. Um, so let's take a look. So, what exactly is happening when a person is smoking? Smoking essentially, as an end result, increases the risk of cardiovascular disease, COPD, cancer, stroke, various other diseases that could occur. Um, so, what happens? So, when a person starts smoking, there are these particles that gets released into the starting from the lungs. And these are the nicotinic particles or nicotine, and they bind to the acetylcholine receptors once it reaches the brain. It takes approximately 10 seconds to get there from the lungs straight to the bloodstream that gets to a brain, and then it binds to the nicotinic receptors, and that actually opens up the sodium calcium uh, channel influx. And so when it goes into the cell, it actually um, triggers the release of dopamine. And dopamine essentially is used for pleasure, reward, reinforcement. And as time goes on, person feels like they're not getting enough dopamine in their brain. Um, they would continually smoke, and then repeated nicotine exposure then leads to desensitization of regulation of the receptor number. And what that is that because these nicotinic particles need to bind to the nicotine receptors and to at least trigger the release of that neurotransmitter dopamine, um, it's going to eventually, the nicotine particles are not going to be able to really sense the receptor, or it's going to reduce the sensitivity of that receptor. So, or receptors going to reduce that sensitivity. So, to the nicotine particles. And so that's going to lead to more increased symptoms, withdrawal symptoms occurs because not much nicotine is getting um, sensed by the receptors. And also upregulation because of that sensitivity concern. Um, the receptors start to, you know, numbers of these receptors start to grow, and more receptors grow, which means there's less nicotine to bind to. So now that's another issue there. So it's going to cause all sorts of problems here. Um, so withdrawal symptoms occur when the nicotine stops, and that can lead to cravings, irritability, anxiety, depressed mood, difficulty concentrating, restlessness. So what this diagram is just to show you exactly what's happening here. So these yellow circles here, essentially I just kind of drew a rough diagram just to show that as like a cigarette is taken, nicotine is being released, going through the lungs, which is here in the gray, and then it goes through the bloodstream, goes to the brain area, which is in the light blue, and then it binds to the nicotinic receptor and causes influx of calcium and sodium. Why calcium and sodium needs to be influxed? Well, calcium and sodium is actually going to trigger or cause the electrical signaling to occur where it will actually uh, associate with increase in dopamine release. So when there's that influx, it's going to um, cause the electrical signaling there. So dopamine is getting released, then it's going to bind to the dopamine receptors and cause reward. And so the more that's taken, the less, um, the more the person smokes, the less amount of nicotine is actually being absorbed, and it can result in withdrawal symptoms and side effects. Eventually, it's going to lead to other comorbidities, and like it can worsen asthma, COPD, which is COPD. Smoking is generally like the number one um, thing that causes COPD. Um, then you have like heart issues. Shortness of breath may occur because the lungs are now really um, having a lot of that. Um, I just want to say it's going to cause much more like of that kind of like dirt going into, or tobacco going into the lungs and clogging up some alveoli tissues and stuff like that. So it's definitely very important um, to reduce those kind of withdrawal symptoms and even symptoms that persist after smoking as well. So um, there are some therapies and treatments, nicotine replacement therapy. Um, I'm sure some of you have heard of like gum, patches, nicotinic. Maybe I've seen them at the pharmacy, at the stores, or they sell them over the counter. Like some of them, like nicotinic patches, nicotinic gum, um, and I believe they have those um, sublingual nicotine um, stuff. So I'm going to explain the mechanisms briefly on these three. It's not very difficult to understand, but nicotine replacement therapy, I do want to mention that actually helps to reduce cravings and withdrawals. Um, it kind of works just like a cigarette smoking, but instead of too much amount of nicotine, it actually has a moderate amount that gets released into blood and very controlled. So you wouldn't feel it's not like a sharply causes dopamine release. So it's it's actually a great way to stop smoking through these nicotine replacement therapies. Bupropion is a great one too. Bupropion is essentially working more in the structure where the dopamine binds to the receptor and causes reward and motivation and all. It doesn't bind to that receptor but prevents the reuptake of dopamine and norepinephrine. And the varenicline actually is a partial agonist that binds to the nicotine receptor. Similarly, like nicotine replacement therapy, um, just to reduce that cravings and withdrawals and everything too. And a main way of smoking cessation. You probably have heard of Chantix as a brand name for varenicline. So that's one of the ways of doing it. So this is just a brief overview of this whole lecture, just so you understand some of the therapies for smoking cessation. They might not ask too many questions on it, but at least having an idea of how it works is important. Um, so I'm going to show you some diagrams here so you can see how um, smoking cessation works. You can see here I kind of took a snippet or a snapshot or small image of the diagram from the previous slides, where how nicotine is going through blood, binding to the nicotinic receptor and releasing dopamine. That's essentially what this does, but in a very controlled way. Um, so it's not like so much nicotine at once, going and releasing and causing immediate release of a dopamine. Like, not so much nicotine causes immediate release of dopamine. It kind of helps and preventing um, someone from smoking because it kind of replaces that nicotine that this cigarette is releasing. Um, Eventually, over time, a person would not need to smoke anymore because this method is actually to keep the person under control in terms of the dopamine amounts that's getting released into the system. And bupropion, like I mentioned, it just blocks those transporters in the presynaptic terminals um, of the central nervous system. So you can see here, I kind of drew two very light blue uh, transporter diagram here. In the dark blue with the B, those are the bupropion particles. They're kind of blocking that transporter so that dopamine does not go right back up to a presynaptic terminal and turn off the signal of that neurotransmission. So that's essentially what this does. And then varenicline, like I said, it's just a partial agonist of the nicotinic receptor.